Kelly has recently been having heart palpitations and headaches. She's also extremely tired. Blaming her symptoms on school related stress, she decides to go see a doctor. At her appointment, Dr. Jill asks Kelly about her symptoms and writes them down in her electronic health record. She also consults Kelly's electronic health record to see if she exhibited similar symptoms in the past. Kelly tells Dr. Jill that she noticed that her smartwatch had recorded high heart rates. After listening to Kelly, Dr. Jill suspects that Kelly may have a generalized anxiety disorder. She gives her an assessment questionnaire to complete. After another appointment, using the digital health data that she collected from Kelly, Dr. Jill diagnoses her with a generalized anxiety disorder. She advises Kelly to start seeing a psychologist on her team and gives her tools to manage her anxiety, such as relaxation techniques. When Dr. Jill used Kelly's digital health data, such as her electronic health records and her answers to the assessment questionnaire, to diagnose her and suggest treatment, this was an example of the primary use of digital health data. Primary use of digital health data refers to data being generated and used within the context of hospitals and doctors' offices to deliver individual healthcare and to make decisions about the care of the individual from whom it was collected, which in this case is Kelly. Digital health data may also be used for purposes other than individual healthcare. Secondary use of digital health data refers to the non-direct care use of data for purposes such as research and discovery, improving quality and safety of care, education, policymaking, and safety monitoring, among others. Kelly has been doing the relaxation techniques that her psychologist and Dr. Jill recommended. She feels that they are helping her and that her anxiety levels have decreased. During her follow-up appointment with Dr. Jill tells Kelly about a clinical research study being conducted by her colleague, Dr. Matthews, about the outcomes of different anxiety treatments. She tells her that she might benefit from participating in this study as it can introduce her to other techniques to manage and reduce her anxiety. After meeting Dr. Matthews, Kelly decides to enroll in the study. On her first day participating in the study, Dr. Matthews gives Kelly 2 consent forms to sign. The first form seeks Kelly's permission for Dr. Matthews to access her electronic health record, which contains her medical history and a description of her symptoms. By signing this form, Kelly consents to the secondary use of the digital health data previously collected and stored in her electronic health record by Dr. Jill. The secondary use of Kelly's digital health data will help Dr. Matthews better understand the participants in the study and see which anxiety treatments are better suited for specific types of patients. The second form seeks Kelly's permission for Dr. Matthews to collect data about her health during the study. Kelly's digital health data may be collected through experiments, observations, surveys, questionnaires, and interviews. The form describes the pros and cons of being part of the study and explains how Kelly's data will be collected and stored during and after the study. The form specifies that her data will only be shared with third parties with her consent. The digital health data collected by Dr. Matthews can have primary and secondary uses. The primary use of the digital health data collected during the study consists in Dr. Matthews using and interpreting the data for the specific purposes of the study. That is, comparing different anxieties and treatments. The digital health data collected during the study may also be used for purposes other than the specific purpose of the study, if, for example, Kelly consents to the use of her data by a third party. This refers to the secondary use of digital health data. By the end of the study, Kelly understands the importance of being involved in different research activities and the benefits of sharing digital health data across different actors to inform research and improve delivery of healthcare services. The healthcare data collected by both Dr. Jill and Dr. Matthews was used to better understand anxiety treatments, which in turn helped Kelly better cope with her symptoms.